Understanding Stem Cell Transplants, a comprehensive guide. The world of modern medicine continues to evolve with groundbreaking treatments that push the boundaries of what's possible in healthcare. Among these innovations, stem cell transplants stand out as a remarkable therapeutic approach that offers hope to patients facing various medical challenges. This comprehensive guide delves into the intricate world of stem cell transplants, exploring how they work, their various types, and what patients can expect throughout the process. The foundation of stem cell therapy. Stem cells are extraordinary components of our body's cellular makeup, possessing the unique ability to transform into different types of cells. This remarkable characteristic makes them invaluable in medical treatments, particularly for conditions that require cellular regeneration or replacement. The versatility of stem cells has revolutionized treatment approaches for numerous conditions, especially in cases where traditional therapies may fall short. Types of stem cell transplants. The field of stem cell transplantation encompasses several distinct approaches, each tailored to specific patient needs and medical circumstances. The primary categories of stem cell transplants reflect the source of the stem cells and their relationship to the recipient. Autologous transplants. Using your own cells. In autologous transplants, medical professionals harvest and use the patient's own stem cells. This approach is particularly valuable when a patient is scheduled to undergo treatments that might damage their existing stem cell supply, such as intensive chemotherapy or radiation therapy. The process begins with collecting stem cells from either the patient's bone marrow or blood, which are then carefully preserved through freezing. Following the completion of their primary treatment, these preserved cells are reintroduced into the patient's bone marrow, allowing for cellular regeneration. Allogenic transplants. The power of donation. Allogenic transplants represent a different approach, utilizing stem cells from a donor whose tissue type closely matches that of the recipient. The success of these transplants heavily depends on finding a compatible donor, with close family members often presenting the best matches. When family members aren't suitable matches, national donor registries provide an invaluable resource for finding compatible donors. Within the category of allogenic transplants, two specialized types exist. Syngenic transplants represent a unique situation where the donor is an identical sibling, such as a twin, ensuring perfect tissue compatibility. Cord blood transplants, another form of allogenic transplantation, utilize stem cells harvested from umbilical cords or placentas, which contain particularly concentrated and viable stem cells. The journey to transplantation. The path to receiving a stem cell transplant involves careful preparation and evaluation to ensure the best possible outcomes. This journey begins with comprehensive medical screening and continues through several distinct phases. Pre-transplant evaluation. Before proceeding with a stem cell transplant, patients undergo thorough medical evaluation to confirm their fitness for the procedure. This assessment typically includes a comprehensive blood analysis. Evaluates both blood cell counts and organ function, particularly focusing on the liver and kidneys. Cardiac evaluation through electrocardiogram (ECG) examinations ensures heart health and function. Advanced imaging studies, including echocardiograms, X-rays, and CT scans, provide detailed information about organ health and function. For cancer patients, tissue biopsies may be necessary to guide treatment planning. The transplantation process. The actual transplantation process unfolds in three distinct phases, each crucial to the procedure's success. First, the collection phase involves gathering the necessary stem cells, either from the patient themselves in autologous transplants or from a donor in allogenic procedures. This process typically spans several days and begins with medications to boost stem cell production, followed by careful collection through the blood or bone marrow. The pre-transplant treatment phase often involves intensive therapy to prepare the body for the new stem cells. This may include high-dose chemotherapy or radiation treatments, typically lasting between 5 and 10 days. Finally, the transplantation itself occurs through an infusion process lasting approximately 30 minutes. Medical professionals deliver the stem cells through a catheter placed in the patient's chest, which also serves as a port for administering other necessary medications. Recovery and beyond. The recovery period following a stem cell transplant represents a critical phase in the treatment journey. Patients typically remain hospitalized for several weeks following the procedure, allowing the transplanted stem cells to establish themselves in the bone marrow and begin producing new blood cells. During this time, medical professionals closely monitor patients for any complications and provide supportive care as needed. The initial recovery period can be challenging, with patients often experiencing various side effects including weakness, gastrointestinal issues, and decreased appetite. Medical teams work to support patients through these challenges, often providing blood transfusions to maintain healthy red blood cell levels and implementing strict infection control measures to protect patients while their immune systems rebuild. Most patients reach a point where they can return home within 1 to 3 months post-transplant, though the journey to full recovery continues well beyond hospital discharge. The immune system typically requires significant time to regain full strength, potentially leaving patients at increased risk of infection for up to 2 years following the procedure. The role of stem cell donation. The success of stem cell transplantation programs relies heavily on the availability of willing donors. National registries play a crucial role in connecting patients with compatible donors when family members aren't suitable matches. These organizations maintain databases of potential donors and facilitate the matching process between donors and recipients. Cord blood donation represents another valuable source of stem cells for transplantation. This process, which involves collecting stem cells from the umbilical cord and placenta following childbirth, provides a safe and effective way to contribute to the stem cell donation network without any risk to mother or child. Looking to the future as medical science continues to advance, stem cell transplantation remains at the forefront of innovative therapeutic approaches. The procedure offers hope to patients facing various medical challenges, from blood cancers to other conditions requiring cellular regeneration. The success of these treatments depends not only on medical expertise but also on the continued participation of donors in both traditional stem cell donation programs and cord blood banking initiatives. Understanding the complexities of stem cell transplantation helps patients and their families navigate this challenging but potentially life-saving journey. As research continues and techniques evolve, the field of stem cell therapy promises to offer even more hope and healing to patients in need. The development of stem cell transplantation represents one of medicine's most significant achievements, offering new possibilities for treatment and recovery to patients worldwide. Through careful matching processes, meticulous medical procedures, and dedicated post-transplant care, medical professionals continue to refine and improve these life-changing treatments, providing hope and healing to countless individuals in need of cellular regeneration and renewal.